Good morning. My topic is assessment of the choroidal thickness in the pachychoroid disease spectrum. So, pachychoroid disease spectrum are a group of clinical entities that are characterized by thickened and hyperpermeable outer choroidal vessel layer, which is the hallux layer. The average choroidal thickness is around 260 micrometers, the highest being at the level of the macula. And the spectrum includes the following entities, that is the pachychoroid pigment epitheliopathy, central serous chorioretinopathy, pachychoroid neovasculopathy, polypoidal choroidal vasculopathy, and the newly added entities peripapillary pachychoroid spectrum and the focal choroidal excavation. The aim of our study was to analyze the choroidal thickness among the patients of pachychoroid disease spectrum and to evaluate their choroidal vascular morphology. So, we conducted a retrospective study at a tertiary eye institute in South India. In our study, we took the EDI OCT of 79 eyes of 45 patients who were already diagnosed to have a pachychoroid in our retina clinic, and it was analyzed for the choroidal thickness and the choroidal vascular morphology. The choroidal thickness was measured in the central 3000 micrometer cut section using the calipers tool by taking the average of 3 points at the level of the central macula. In the same section, we studied the choroidal vascular morphology that included the number of pachyvessels which were manually counted, as well as the mean pachyvessel diameter that was also measured using the calipers tool. So, our results were as follows. 76% of the study population showed a bilateral presentation, that is in among 34 patients. Among the various entities studied, uncomplicated pachychoroid was more common than the pachychoroid disease spectrum. And uncomplicated pachychoroid were characterized by thickened choroid and the presence of pachyvessels, but there was no retinal alterations. Among the pachychoroid disease spectrum, central serous chorioretinopathy was the most common. A male preponderance was observed. So, the age of presentation varied among the various entities we studied, with central serous retinopathy presenting at a younger age, average of 39.5 years, and uncomplicated pachychoroid, pachychoroid pigment epitheliopathy, and peripapillary pachychoroid spectrum presented in the older age. The choroidal thickness ranged from 350 to 400 micrometers, the average of 387.88 micrometers, and the maximum choroidal thickness was observed in polypoidal choroidal vasculopathy, followed by pigment epitheliopathy and central serous chorioretinopathy. On evaluation of the choroidal vascular morphology, we observed that the average number of pachyvessels were more in the pigment epitheliopathy, followed by pachychoroid neovasculopathy and the polypoidal choroidal vasculopathy. And mean pachyvessel diameter was observed to be larger in the polypoidal choroidal vasculopathy, followed by pigment epitheliopathy and central serous retinopathy. So, the results that we observed in the mean pachyvessel diameter was similar to the results we got in the mean choroidal thickness. In our study, among the pachychoroid disease spectrum, central serous retinopathy was the most common and the least common was pachychoroid neovasculopathy. So, our finding was similar to a study conducted by Dansingani et al. Central serous retinopathy presented at a younger age, whereas pachychoroid pigment epitheliopathy presented in the older age group. However, a study conducted by Rosa Dola Marco et al. Showed that both central serous retinopathy and pigment epitheliopathy presented at a younger age. The average choroidal thickness was 387.18 micrometers, the highest being in the polypoidal choroidal vasculopathy that was also observed to have a large mean pachyvessel diameter. And a study conducted by Veronica Castro Navarro et al. Showed that it was the presence of dilated choroidal vessels which was a defining criterion for pachychoroid. However, the average number of pachyvessels were observed to be more in the pigment epitheliopathy. So, though the number of pachyvessels are more in pigment epitheliopathy, the choroidal thickness and the mean pachyvessel diameter were observed to be more in polypoidal choroidal vasculopathy. Hence, we were able to conclude that the severity of a pachychoroid disease spectrum is predominantly determined by the pachyvessel diameter and the choroidal thickness rather than the number of pachyvessels. And we also suggest that patients with uncomplicated pachychoroid and large vessel morphology be followed up more frequently to look for any progression to the pachychoroid disease spectrum. These are my references. Thank you.
What's your inclusion criteria?
Ma'am, any choroid thickness more than 300 micrometers who were already diagnosed to have a pachychoroid in the retina clinic.
So what exactly was your question?
Ma'am?
What exactly was your research question?
Our aim was to analyze the choroidal thickness so that we can
But you have already
diagnose.
decided that the choroidal thickness should be this high before
Yes,
you
ma'am.
take these patients. So what was your question?
So we could also see the progression, whether the disease is going to
Did you
progress
look for
by.
progression or was it a 1 month study?
It was
Yes.
a May to July only we conducted the
One
study.
or
So
two
we
month
need to.
study. So
Yes,
how
ma'am.
much time did you get for progression? And you these different diseases had different group numbers.
Yes,
How are
ma'am.
you going to correlate the group with like that? I mean, you had more of uncomplicated
Yes,
pachy.
ma'am.
This I don't know what you mean by uncomplicated. Means just thickness was there.
They have a thick choroid and they have pachy vessels, but there is no other retinal pathology, no alternation. So no
No
clinical,
clinic, no change on OCT or
only the OCT
so you
finding.
have actually, I'm not very sure what exactly was your research. It's not clear at least what you have tried to look for. And so when your question is not correct, I don't think your conclusion could be. Because in that case, you'll have to compare these equal groups. I mean, that's my.
It's right. No, can you answer the medical question? How you correlated the correlative weakness?
Study. Sir, we need to follow up these patients again with OCT, analyze the choroidal thickness in the. Yes. Aim. Mm. Yes.
And the thickness was measured by caliper.
Caliper tool in the OCT.
By a single person or
I did myself. Yes, sir. Thank you, sir.